Hello everyone, welcome to today's lecture on cell injury. This is an important topic in pathophysiology. Before we understand the disease like myocardial infarction, diabetes mellitus, stroke, liver disease, or kidney failure, we first need to understand what happened to an individual cell. Every disease begins with changes occurring at the cellular level. Therefore, understanding cell injury forms the foundation of understanding pathophysiology and pharmacology. In today's session, we will discuss about the definition of cell injury, cellular response to stress, cellular adaptation, types of cell injury, causes or etiology of cell injury. Cell injury is defined as a variety of stress that a cell encounters due to the change in the internal and external environment. Let us understand this in simpler words. Every cell in a body functions normally only when its internal environment remains stable. This stable condition is called as homeostasis. However, throughout life, cells are constantly exposed to various stress. These stress may be originated from inside the body, such as genetic abnormalities or nutritional imbalance, or from outside the body, such as trauma, infections, chemicals, or radiation. Initially, the cell tries to adjust itself. If the stress is mild, the cell survives. If the stress becomes severe or prolonged, the cell gets injured. Think of a mobile phone battery. If you use it continuously without charging, its performance gradually decreases. Similarly, cells lose their normal function when they cannot cope with the stress. So how does a cell respond to stress? The response of cell depends mainly upon the two important factors. The first factor is the type of cell or the tissue involved. Different cells have different capacities to tolerate injury. For example, brain cells are extremely sensitive to lack of oxygen. On the other hand, skin cells can tolerate injury much better. The second factor is that the extent of the type of cell injury. A mild injury may produce only temporary changes. A severe injury may destroy the entire cell. Therefore, not every harmful stimuli can immediately cause cell death. The outcome depends upon the nature of the stimulus and the resistance of the affected cell. Now, what's cellular adaptation? Before the cell becomes injured, it is often trying to adapt. When there is increase in the functional demand, the cell adapts morphologically and returns to normal once the stress is removed. This process is called a cellular adaptation. Adaptation is usually a protective mechanism. Instead of dying, the cell immediately changes its size, its number, or its activity, so it can continue functioning. For example, a person who is exercising regularly develops a larger skeletal muscle. The muscle cells have adapted to increasing the workload. Similarly, during pregnancy, the uterus enlarges because its cells adapt to hormonal stimulation. If the stress disappears, many of these adaptations reverse and the cell returns to the normal state. This shows how remarkable the body's protective mechanisms are. Now let's see the types of cell injury. There are two main types of cell injury. The first is reversible cell injury and the second is irreversible cell injury. When the stress is mild or moderate, the injured cell recovers after removal of the harmful stimuli. This is called as reversible injury. For example, temporary reduction in the blood supply to the muscle during vigorous exercise causes fatigue. After adequate rest, the muscle recovers completely. The second type is irreversible cell injury. When the injury persists for a longer period of time, the damage becomes permanent and the cell eventually dies. Therefore, the important difference is simple. Reversible injury means recovery is possible. Irreversible injury means recovery is no longer possible. Even after recovery, Some evidence of cell injury may remain inside the cell. One is its subcellular changes may be persistent. Two, metabolites may accumulate inside the cell. This means the cell survives. The organelles may still show mild alterations. Similarly, certain substance may accumulate because of normal metabolism was temporarily disrupted. These changes helps the pathologist to identify previous cellular injury under microscope. This picture you can see the normal cell, how the normal cell appears with all the internal organelles present inside the cell. So the cell has the main nucleus, and inside the nucleus we have nucleolus, and the cell membrane is covering or binding the cell. And inside we see so many organelles like lysosomes, then endoplasmic reticulum, then ribosomes, then mitochondria, which is all vital for functioning of the cell. So how does a cell respond to a cell injury? A normal cell undergoes alteration or changes depending upon the type of injury which is caused and the duration which the time duration the injury is happening, or the length of the injury happening to the cell. Okay. Normal cell will be undergoing changes, respectively adaptation, or it can be reversible cell injury or irreversible cell injury. So when there's an increase in demand or alteration in the functional requirement, the cell undergoes change, which we call it adaptation. So adaptation can be an atrophy or hypertrophy, hyperplasia, metaplasia, or dysplasia. When the stress is removed, the cell restores the normal structure and function. When the stress is mild to moderate, the cell undergoes change, and we call the change as reversible cell injury, where the cell can undergo degeneration, alteration at the subcellular level, and it can also lead to accumulation of substance inside the cell. This condition is also reversible when the stress is removed, and the cell undergoes a process called as repair and healing, where the cell can retain the structure and function. When the injury cost is severe, or there's a persistent stress caused to the cell, then it becomes irreversible cell injury. This cell undergoes a change and ends up into cell death. Now let's see the etiology of cell injury. Etiology can be broadly categorized into genetic causes and acquired causes. So any change in the genetic level might be resulting in change in the genetic level, and it can cause alteration to the cellular level, and which can lead to a lot of disease genetically related to. Let's focus on the acquired causes of cell injury, where under this we have a huge list of agents which might be causing cell injury. One is hypoxic and ischemic injury, physical agents, chemical agents, microbiological agents, immunological agents, nutritional dearrangement, aging, psychological stress, iatrogenic factors, idiopathic disease. So this can be the reason for a cell to develop cell injury. Let's now focus on each and every individual etiological agent, and let's see how these agents can cause cell injury individually. So the first one is hypoxic and ischemic injury. So what is this hypoxic and ischemic injury? It's the first acquired cause of injury. First, hypoxia means reduced oxygen supply, and ischemia means reduced blood supply. So along with this, when there is reduced blood supply and reduced oxygen supply, it leads to the damage to the cells. Along with this, there can also be depletion of oxygen, blood, decreased levels of RBC, or a person who's having anemia. Disease of heart or lung is also an important factor for the contribution of hypoxic and ischemic injury. So here you can see that the blood supply, when it is blocked, then the oxygen supply is also blocked. The heart muscle receives lesser oxygen. If it continues, the heart cells might become injured. This is exactly what is happening during a heart attack. So next agent is the physical agent. So physical agents like mechanical trauma, thermal injury, electricity, radiation, atmospheric pressure can cause injury to the cells, which is listed under the physical agents which is causing injury to the cell. Next is chemical agents. Chemical agents are important agents which has the capability of causing a lot of toxicity and damage to the cells. So chemical poison which is happening due to intake of cyanide or arsenic or mercury poisoning. Strong acids and alkali are also a main reason for causing cellular injury. Next, environmental pollutants, insecticides and pesticides, oxygen at a higher concentration, hypertonic glucose and salt, alcohol, nicotine, narcotics, and some drugs plays a vital role in causing an injury to the cell, which is due to chemical agents. Next, we are going to see the microbiological agent. So the microbiological agents includes of bacteria, virus, fungi, protozoan, rickettsia, metazoans, and the other parasites. These organisms damages the tissue either directly or indirectly by releasing toxins. Next, we are going to see the immunological agents, which includes of the reaction caused to the cells like hypersensitivity reaction, anaphylactic reaction, autoimmune disease. Sometimes our own immune system mistakenly attacks healthy tissues, resulting in cellular injury. Next important factor is the nutritional derangement. So either can be caused due to deficiency or excess of nutrients entering into the system. So the risk factor which is listed under the deficiency disorder are marasmus, kwashiorkor, anemia. As well, the excess nutritional may lead to conditions like obesity, atherosclerosis, heart disease, hypertension. Next, aging is an important factor for cellular injury. As we grow old, cells gradually lose their ability to repair themselves, making them more susceptible to injury. So problem starts with replication and repair. Cell might die and the death of the individual can happen. Psychological stress is another important factor which has to be considered because this is becoming more and more important factor nowadays for many a disease which is as a result of the psychological stress. So under this category, we have a variety of causes which includes of stress, strain, anxiety, overwork, depression, frustration, drug addiction, alcoholism, and conditions like schizophrenia can also contribute to the cellular damage either directly or indirectly. Now, what is this iatrogenic factor? So iatrogeny means injury caused unintentionally during medical treatment. For example, an adverse drug reaction or surgical complication which is developed during a treatment means idiopathy. So idiopathic means the exact cause is unknown. Despite extensive investigation, sometimes the underlying cause cannot be understood. Let's summarize today's lecture. We learned that cell injury results from changes in the internal or the external environment. The cellular response depends on the types of cell and the severity of injury. Cells initially adapt to stress through cellular adaptation. Cell injury might be reversible or irreversible. The causes includes genetic factor and acquired factors such as hypoxia, chemical infection, immunological disorder, nutritional imbalance, aging, psychological stress, iatrogenic causes, idiopathic disease. Understanding these concepts provides a basic for studying the disease mechanism in pathophysiology
and rationale behind the pharmacological treatment. I thank you for watching this video, and in our next session we'll be able to continue the subsequent topics in the cell injury. Thank you.